It doesn't begin with pain. It doesn't come with fever or swelling. It starts quietly, like a whisper under your skin. One morning, you glance down at your feet and notice something odd. A little yellow at the edge of your big toenail. It looks thicker than it used to, a bit more curved, slightly rougher in texture. It's not painful and you think, it's just part of getting older. So you brush it off. Weeks pass. That nail becomes even thicker. You try to trim it, but the clippers barely scratch the surface. Now it's discolored, possibly brown, and oddly shaped. You stop wearing sandals. You even avoid walking barefoot around family. Maybe someone commented on it and now you're embarrassed. But here's the truth. This isn't just about vanity or an aging nail. It could be something far more serious. What you're seeing might be a fungal infection. In medical terms, it's called onychomycosis, and it affects 1 in 3 people over 60. That's a staggering number. And even more concerning is how many people ignore it until it becomes painful, dangerous, or disfiguring. Toenail fungus in seniors isn't just a cosmetic concern. Left untreated, it can cause severe discomfort, nail deformity, secondary bacterial infections, and for people with diabetes or poor circulation, it can lead to ulcers, skin breakdown, and even amputations in extreme cases. Let that sink in. Something as small as a discolored nail can lead to limb-threatening problems. So why is this so common in older adults? First, we need to talk about circulation. As we age, our blood flow slows down, especially to our feet. This means fewer immune cells and nutrients are reaching the extremities. If a fungus enters the skin or nail, the immune system has a harder time fighting it off. It's like trying to put out a fire with a weak garden hose. The infection gets a head start, and by the time your body notices, it's deeply rooted. Next, there's nail trauma. We don't think about how often we stub our toes, wear tight shoes, walk long distances, or clip our nails poorly. These little incidents, repeated over years, can damage the nail bed, creating tiny cracks and openings where fungi sneak in and thrive. Fungus loves warm, dark, moist spaces, and under a toenail is ideal. Plus, conditions like diabetes, arthritis, nephropathy, and autoimmune disorders weaken the body's ability to heal or fight infection. Seniors are often on medications like steroids or chemotherapy that further suppress immune response. Then there's the reality of aging skin and nails. With age, nails grow slower and become thicker, drier, and more brittle. The skin around them is thinner and easier to tear. This fragile environment becomes a breeding ground for infections. Add in shared slippers, public showers, nail salons, or even walking barefoot at home, and the risk increases. Let me share a story. Linda, a 68-year-old retired schoolteacher, noticed a small yellow spot on her big toe. It didn't hurt, so she ignored it. Over 6 months, the nail thickened, cracked, and separated from the nail bed. Eventually, it became so painful that walking was difficult. By the time she sought help, the fungus had spread to 3 other toes. Her podiatrist prescribed oral antifungal medication, topical creams, and partial nail removal. Her recovery took 8 months. When I asked why she waited so long, she said, "I thought it was just old age." Linda's story isn't rare. It's common. Toenail fungus doesn't just happen overnight, but when left untreated, it never stays the same. It gets worse. So what causes it in the first place? Most commonly, public showers, gyms, nail salons with poor hygiene, tight shoes, sweaty feet, or shared tools like nail clippers or towels. Can even come from untreated athlete's foot. The moment fungus finds a way under your nail, it starts eating the keratin, the protein your nails are made of. It gradually breaks down the structure of the nail, leaving it discolored, thick, flaky, and brittle. Early warning signs include pale yellow or brown discoloration, nails that feel harder than usual, or those that start lifting from the skin. You may also see white spots or chalky textures, or notice an unpleasant smell when you remove socks. These symptoms are often dismissed as just aging, but they're not. They're red flags. So now you know how and why it happens. In the next section, we'll explore what to do about it, starting with what treatments actually work. Now that we've uncovered why toenail fungus is so common after 60, let's talk about the signs and what to do if you see them. The earlier you act, the easier it is to treat. Common symptoms include yellow, brown, or white discoloration. The nail might feel unusually thick or hard. Sometimes it starts curving downward or curling under itself. You might see parts of the nail lifting away from the skin, can crumble, crack, or look distorted. A mild odor is also common, and in more advanced cases, it may become painful to walk, especially in closed-toe shoes. One of the biggest mistakes older adults make is assuming these changes are normal. They're not. Toenail fungus is not a harmless nuisance. It's an infection. And like all infections, the longer you wait, the more difficult it is to treat. So what are your options? Let's start with home remedies, which work best in the early stages. First up, tea tree oil. This natural antifungal is widely recommended. Use a cotton swab to apply 1 to 2 drops directly on the nail twice a day. Massage it in gently and let it absorb. This method requires patience, usually 6 to 12 weeks or longer, but it can slow or even reverse early fungal growth. Another option is Vicks VapoRub. Strange, right? But some studies show that the menthol and eucalyptus oils may help fight fungus. Apply a small amount daily and cover the toe with a clean sock. You can also try apple cider vinegar soaks. Mix 1 part vinegar with 2 parts warm water and soak your feet for 20 to 30 minutes daily. Add a spoon of baking soda if you have sweaty feet. It reduces moisture and fungal activity. For mild cases, these remedies may help prevent spread and soften the nail. But if the infection has progressed, if the nail is completely discolored, thickened, or painful, it's time to talk to your doctor. Medical treatments come in 3 main forms. Topical antifungal medications, like cyclopirox or efinaconazole. These are applied daily like nail polish. They work better on mild to moderate cases but require months of consistent use. Oral antifungals, like terbinafine or itraconazole. These go through your bloodstream and attack the fungus from the inside. They are more effective than topicals but can have side effects, especially for people with liver issues or other conditions. Your doctor will likely order blood tests to monitor safety. Laser therapy, a newer option, uses targeted light to destroy fungus beneath the nail. It's painless, quick, and has shown promising results, but it's often not covered by insurance and can be expensive. So, which option should you choose? If your case is mild, home care may be enough. If it's moderate to severe, you'll need a combination of medical treatment and patience. Either way, one thing is absolutely critical: consistency. Most people give up too early. They see no results after a few weeks and quit. But toenails grow slowly, especially as we age. It can take 6 to 12 months for a completely new, healthy nail to grow in. That means even with successful treatment, you won't see perfect results overnight. You need to commit to the full process. And don't forget, as one nail heals, others may still be vulnerable. Treat all affected toes together. Disinfect nail tools after every use. Wash socks in hot water. Spray your shoes with antifungal spray at least once a week. The fungus might die in your nail, but if it lingers in your shoes or socks, reinfection is just a step away. Also, be cautious at nail salons. Choose places that sterilize tools properly and bring your own clippers if possible. Avoid salons that rush or clip nails too short, as this increases your risk of trauma and infection. So far, we've covered what causes toenail fungus, how to spot it, and how to treat it. But how do you stop it from coming back? That's what we'll explore next, because prevention is just as important as treatment. After treating toenail fungus, the goal isn't just to heal, it's to stay healed. Recurrence is common, especially in seniors. But the good news? With the right habits, you can keep it from coming back. Start with your shoes. Choose breathable materials: leather, mesh, canvas. Avoid plastic and vinyl that trap moisture. Rotate shoes so each pair has 24 hours to fully dry. Spray inside shoes weekly with an antifungal product or dust them with foot powder. Always wear clean, dry socks, preferably moisture-wicking types made of cotton or bamboo. Foot hygiene is critical. Wash your feet daily with soap and warm water and dry them thoroughly, especially between the toes. Never leave your feet damp. Trim your toenails straight across and keep them short to prevent trauma. Disinfect your nail clippers after every use. Never share them with anyone. At home, avoid walking barefoot if you live with others or use shared bathrooms. In public, always wear shower shoes at pools, gyms, or locker rooms. And yes, it's okay to be picky about nail salons. This is your health we're talking about. Your diet also plays a role. Strengthen your immune system with foods rich in zinc, iron, biotin, and probiotics. Garlic, leafy greens, yogurt, and omega-3s all support skin and nail health. A well-fed body resists infections better, inside and out. Above all, check your feet regularly, especially if you have diabetes or circulation issues. Look for changes in color, texture, or pain. What starts as a small spot can become a big problem if ignored. So here's the truth. Caring for your feet isn't vanity. It's self-respect. Your toenails can reveal signs of aging, infection, even internal illness. Don't ignore them. If you've made it this far into the video, you're already ahead of the curve. You're informed. You're paying attention. And that's the first step toward healing. Please like this video if it helped you, and subscribe to our channel if you want more simple, trusted health content made for people just like you. Share this with someone over 60. It could change their life. Your health matters. From head to toe.